problem with prevention in terms of drama is that if you're successful, nothing happens. This is just a wonderful slide. You can't really read the numbers, but the stuff on the top is, to me, just, it's unreal. You know, we diagnose more strokes than ever these days because you can find a stroke, you can find an infarct on an MRI scan the size of a grain of rice. No problem. You're not going to miss it. DWI is going to find it. And if the patient has focal symptoms and the MRI scan is positive in the appropriate place, that today is a stroke. Okay, so knowing the incidence of stroke over time is very difficult because the temperature, the thermometer keeps changing. Mortality, though, doesn't really change. People die from a stroke today for the same reasons that they died for a stroke 20 years ago, 30 years ago, and even when I started practice, which was before that. And mortality, therefore, is a better guide to what's really happening with stroke, in my view, and I think in the view of most of my colleagues. And to look at that, a 41% decrease in stroke is absolutely incredible. Remember I mentioned 30% of all strokes used to be from carotid disease, and now it's between 5 and 10, but somewhere around 7 or 8% of all strokes. It's just plummeted. And how many of you are seeing carotid occlusions in your practice? They used to be common. Or those of you who had your patients operated on for carotid disease and a year or two later they had to have a redo. That was common. And today it's just not common. And now, by the way, with atrial fibrillation, the studies showing warfarin work for atrial fibrillation were in the 1980s. When I was in practice, when I started practice, we used warfarin, but it was not widespread. We were scared to use it. We didn't really know did it work, and many of the patients we had on aspirin. Well, now with the NOACs, more and more people with atrial fibrillation are on good treatment, and so that number is going to go down. And those are the two causes of the big strokes: carotid disease, either extracranial, more common, or intracranial large vessel disease, and atrial fibrillation. And both of those are going to continue to go down. Thomas Waller mentioned the Crest Trial. In that trial, we compared 2,502 patients to carotid endarterectomy